So I'm delighted to introduce our second speaker, who is known, I'm sure, by a lot of people, our consultant midwife who's at Cardiff and Vale University Health Board, Abigail Holmes, or Abby. Her role focuses on normality and providing support and guidance for women and families, including birth choice clinics and afterthoughts services, among a lot of other roles. I know she's very passionate about her role within normality and supporting women. So the floor is yours now, Abigail. Welcome.
Thank you very much, Sue. Thank you for having me. I was just going to take you through what we at Cardiff and Vale Maternity Services have been doing in response to the COVID-19 pandemic. And I was going to break it into the 4 aspects of the services. So we've got our antenatal services, our intrapartum care, postnatal care, and then the support that we've been able to intertwine with all of that, with using our antenatal education and the resources that we've made available to our ladies and their families. So if I start with, make the screen, there we are. It's gone too far. With our antenatal services. So the first thing that we did was when our GP surgeries were beginning to close and our access was becoming a little restricted for our women to reach to our midwives, initially for that first referral when they first find out that they're pregnant, we needed to come up with a quick solution for how we could still make sure that these ladies could access our services. So we set up a virtual booking system where the ladies would contact us via email to tell us that they were pregnant, and that would generate the booking forms to go out to them all electronically, so they could very comfortably from their own home complete their initial booking assessments, send them in, and then the midwives within their teams would then contact them and then have their booking appointment done virtually. What's been really exciting about that system is that usually these systems take months of planning of how we're going to obviously our information governance, what kind of processes, we map pathways, we meet about these things, and in this situation we discussed it on the Monday and had it up and running by the Friday, which was really exciting to see the service kind of be rolled out so quickly. And we communicated it to all of our GP surgeries across Cardiff and Vale, and the uptake has been really, really phenomenal, and all of our referrals are coming through electronically now. All of our community midwives have access to the system. We have a grading system so that we can clearly see when a booking's been actioned. So it seems to be working really well, and the women are really speaking positively of it. We've moved a number of our antenatal appointments, particularly the 16-week appointment and the 25-week appointment, to virtual clinic appointments with their named community midwife. And we also offer a healthy pregnancy clinic, which is for our ladies who have a BMI of 35 or above, and that's to support them to be healthy during their pregnancy. So we've moved some of those services into a virtual service as well, depending on whether it's coupled with a growth scan or not. And our birth choices clinics has moved onto an online platform that can be a number of different medias. The majority of ladies have some form of access, either a simple telephone call, or it could be Facebook Messenger, FaceTime, WhatsApp video, or the newly rolled out Talk Anywhere app, which has been rolled out across the NHS in Wales. Again, that started off in primary care and has been moved into secondary care, which again has been really successful. We know that a number of our women were feeling really very anxious about coming to the hospitals, so which I'll talk about a little bit later, but we did then do a virtual tour for the ladies so they could see that the process that they would walk through when they came into the hospital, to reassure them about the precautions that we were taking, the way that we were setting up social distancing within our antenatal waiting areas, and what the staff would be wearing. Sarah did touch upon it, but showing them the PPE that the midwives would be wearing when they were greeted. A number of ladies actually find it really reassuring to know that the midwives will be wearing their PPE, so that was quite good. And we've moved across from recommendations of the Royal College of Obstetrics and Gynecology onto the slightly altered method of testing for gestational diabetes, so that the women aren't sat for long periods of time within the waiting areas. And we have asked that our ladies attend as many appointments as they can, if not all appointments on their own. As the ladies are coming into the areas, they have a screening, which would be a simple history check for symptoms and also having their temperatures taken. We've moved a number of our safeguarding case conferences and core groups onto virtual technologies, which has really embraced multidisciplinary working and able to facilitate good working relationships whilst we're not all able to be in the same room. And what, as well as Sarah noticed, is this huge increase in the uptake of home births, which as a consultant midwife for normality has been just wonderful, because, you know, we talk about home births all the time, and we try to encourage home births as much as we can, but our rates did remain still low, similar to Sarah's, below that 1%, and suddenly we're seeing this huge increase. But what we needed to do was make sure that this decision was made safely. It's always the mother's choice to birth her baby wherever she may choose to. But we wanted to just put those extra processes in for ladies to really have that opportunity to really explore their decisions that they were making. So I offer now a virtual home birth assessment. Now, if a lady had planned to have her baby at home from the onset of her pregnancy, then it's normally a brief conversation. If a lady's option for place of birth has changed in light of COVID, we just explore that a little more to make sure that what their choices are. I do a virtual assessment of the home environment, and that's not to kind of assess someone's home as, you know, suitable for home birth, but look at the logistics, getting to a property, getting access to a property in and out, which normally the midwife would do at their home assessment, which is not what we're not offering at the moment, but we do it virtually. And I've had some wonderful guided tours with webcams around homes and things, so that's worked really well. And there's a group of us that are doing those assessments, and for April, I compared the data to last year. As you can see on my screen, in April 2019 we had 4 planned home births, and for this April we have 26, which takes us from 1% to 6%, which is huge. We've also amended some other local policies under our anemia guideline, and we've upped our threshold, or lowered our threshold, should I say, for offering women treatment with iron, looking at the way Italy responded and their depletion of blood stores within their blood banks. We've now moved our iron levels to 120, and anyone below that, we would offer them some iron therapy, just to minimise that chance of those ladies needing blood products if we were to have any concerns about blood products within Wales. So then when we move into our intrapartum care, we had a very thriving midwifery-led unit within the University Hospital Wales, and a number of the units within Wales have these units. When we looked at the way that we were able to deliver our service and the areas that we would be able to offer care to our ladies that we either suspected or confirmed of having COVID, the decision was made from the health board to centralise our services onto the obstetric unit and offer midwifery-led care within the obstetric service. So it did mean that we had to reduce the number of pools that we were able to offer our ladies. We went from 5 pools to 1. However, with a number of the MLU women now opting to birth their babies at home, that balance still seems to be manageable. What we have noticed is, since re-amalgamating the services that we separated almost out maybe 12, 13 years ago, if not longer than that, when we established our MLUs, has been the staff coming together and seeing this really multidisciplinary working really at its absolute forefront, and the promotion of normality throughout the delivery suite, not just in the midwifery-led units, and seeing the midwives, the obstetricians, anaesthetists, everyone kind of working together. It's been a real marvel to see, and you'll see some of the feedback that the women have been giving us. We've restricted to 1 birth partner, which I think is probably quite universal now for most maternity units, and that's for the duration of the birth or planned caesarean section, and for a short duration afterwards. And we aren't able to accommodate visitors on our antenatal or postnatal wards, and that has seen, again, the unintended outcomes of these things is seeing the women engaging with each other. It's not often you go into a bay now where the curtains are drawn in a 4-bedded bay, the women are sat breastfeeding their babies or feeding their babies and engaging with each other, which is something that many of us remember from when we had the dining room or dining tables in our bays, and seeing the women developing almost lifelong friendships with each other, which has been really lovely to see. Then when we look to our postnatal services, we offer my other half at work is consultant midwife for public health, and she is responsible for our postnatal contraceptive service that we offer all of our ladies, and she now does our daily ward round, and so all of our ladies are discharged home with the method of contraception of their choice, whether that's a coil, implant, depot, or one of the pills. So that's been really useful as well to help those ladies. So when they go home, it's not something else that they've got to consider about that trip to the GP. So that's been really well evaluated by the staff and the women. When our ladies go home, their first day assessment, every lady is contacted on their first day with a virtual assessment, and those essential visits are still carried out. So if there's any safeguarding concerns or any women that has felt to be in need, they will still have their first face-to-face visit with a midwife. If not, it will be virtual. We were very kindly donated many virtual devices from a number of companies across Cardiff, so that we're now able to offer all of our community teams and specialist teams have the devices that they can contact the women and see the babies at home. So if there was a concern about jaundice or anything like that, then we could view those babies at home. One of the big things that we set up in Cardiff was to start with, the Cardiff and Vale Antenatal Education and Support Group, but we noticed very quickly women from other health boards were wanting to join. We opened that out to all of our 7 health boards, and it's now got coming up to 3,500 women and their partners and their families as members of the group. And in that, we've got professional and peer support and bite-sized information, so the ladies can go on and get snippets of antenatal education broken down into small sections. They've got breastfeeding support, antenatal exercise, we've got yoga classes on there, hypnobirthing, birth choice sessions. It's been such a valuable group for the ladies that they've really been really positive about. And what we've also added is professional videos. So we have one of our anaesthetic colleagues giving us an update of the analgesia services that are available for women with or without COVID. We had our home birth service updates, which I delivered. We've got antenatal services. We did notice that ladies were choosing not to come to their appointments. We really wanted to strengthen the message. We'd like them to continue to come if at all possible. We did our tours of the unit so that women could see where they would be coming, to give them that reassurance. And we tried to do these weekly to keep the ladies up to date. They're also for the staff as well, because it's really important that when we're thinking about the home birth provision, that we're keeping our women safe, but we're also making sure our midwives are working in that comfortable environment. So we are asking our ladies to kind of respect the one birth partner rule and just work with us so that we can keep the midwives feeling safe and comfortable working in the ladies' home, and also promoting this wonderful service that would be such a loss if we had to think about cancelling a home birth service or withdrawal of service. But so far, the majority of our health boards have managed to keep them going. And then just finally, to show you some of the feedback from our ladies, and these are the stories that tell us that the women are having, in the light of everything that's going on, the anxiety that they were feeling before they came in to have their babies, not being able to have their partners for them in those first few days after the baby's born, but actually how they're finding things. Are they just wonderful experiences that they're having? We have had some. The first one you can see there from Hannah, with these ladies who gave me permission to share these with you, who had a very quick birth outside of the hospital. She didn't quite make it into the building, but the midwives were there ready and waiting for her. About the friendships they've delivered with the other women. And just feeling that the staff would be going above and beyond. Now, we know as midwives, this is what we do every day. We are passionate about the ladies that are giving birth in a calm and safe and protective way. And this is just from 4 of our ladies, and there are many more out there who can just show that actually, even in a time of crisis that we are all going through and such unknown, that they are still the absolute priorities of our service. And very proud to be midwives looking after them in all sorts of situations. And the emotion that comes through from the midwives and the donations that we're getting very well fed. I don't know if the other units have seen that, how well fed the staff are being with the donations. But yeah, so in times of crisis, there's massive positive, and I hope some of our services don't revert to what they were before. I think that's everything from me.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.